Bird flu. It might sound like a problem for the birds, something we watch on the news about farms far away. However, the reality is different. Bird flu, or avian influenza, is a serious issue that is getting closer to home. This isn't just a problem for our feathered friends anymore. It's affecting us too, impacting our health and our wallets. The current outbreak is the largest ever seen in the United States. It's a wake-up call, reminding us that diseases can jump from animals to humans. This is a story about a virus crossing species and what it means for all of us. This outbreak is a stark reminder that the natural world and human society are deeply intertwined. What affects animals can quickly affect us too. Understanding bird flu, its impact, and how to stay safe is more important than ever. We need to pay attention. We need to be prepared. Bird flu is caused by a type of virus called influenza A. These viruses are masters of disguise, constantly changing and evolving. There are many different strains or subtypes of bird flu virus. Some are mild, causing only minor illness in birds. Others, like the notorious H5N1, are highly deadly. The current outbreak is primarily driven by H5N1. This strain is particularly worrisome because it can cause severe disease in birds, leading to massive die-offs in poultry farms. This isn't just an animal health issue though. H5N1 can also infect humans, and when it does, it can be deadly. The virus spreads easily among birds, especially waterfowl like ducks and geese. These birds can carry the virus without showing any symptoms, spreading it silently through their droppings and saliva. The virus can then jump to other animals, including domestic poultry like chickens and turkeys. This is where the trouble really begins for us. The current bird flu outbreak is having a significant impact on the United States. The most immediate and visible effect is on our economy, particularly the poultry industry. Millions of chickens and turkeys have been culled to stop the virus's spread, leading to a sharp decline in egg and poultry production. Empty shelves in the grocery store and soaring prices are the new normal. The cost of eggs has skyrocketed, and some restaurants have even added egg surcharges to their menus. This is hitting consumers hard, making it more expensive to put food on the table, but the impact goes beyond the economy. As of early 2025, over 70 human cases of H5N1 have been confirmed in the US, with one death reported. While the risk of human-to-human transmission remains low, the fact that people are getting infected at all is a serious cause for concern. Hospitals are bracing for the possibility of more cases, and health officials are closely monitoring the situation. The fear is that the virus could mutate, making it easier to spread between people. If that happens, we could be facing a global health crisis. Section 4. Protecting ourselves, prevention and treatment. The threat of bird flu might seem overwhelming, but there are things we can do to protect ourselves and our communities. The first line of defense is prevention. This starts with awareness. We need to stay informed about the spread of the virus and follow the guidance of public health officials. Simple precautions can make a big difference. Avoid contact with wild birds, especially sick or dead ones. If you work with poultry, wear protective gear like gloves and masks. Wash your hands frequently with soap and water, especially after handling raw poultry. If you experience flu-like symptoms, especially if you've been in contact with birds, seek medical attention immediately. Early detection and treatment are crucial. Antiviral medications like Tamiflu can be effective in treating bird flu if given early in the course of the illness. Section 5. A changing virus, the threat of mutation. Viruses are constantly evolving, and influenza viruses are particularly adept at it. This constant mutation is what makes influenza such a challenging adversary. The bird flu virus is no exception. Experts are concerned that H5N1 could mutate in a way that allows it to spread easily between humans. This is the nightmare scenario, a highly contagious and deadly virus spreading rapidly through the human population. While there's no guarantee that this will happen, the possibility is real and cannot be ignored. Scientists are working hard to understand how the virus is changing and to develop effective vaccines and treatments. We need to be prepared for the possibility of a future where bird flu is not just a threat to birds, but a constant threat to human health. This means investing in research, strengthening our public health infrastructure, and staying informed about the ever-changing world of infectious diseases.